Now we will explore syphilis treatment in more detail. In this lesson, we will revisit the treatment recommendations for syphilis through the lens of staging. And we will take a closer look at important considerations for treatment during pregnancy. And finally, we will explore treatment options for a person with a penicillin allergy. The recommended regimen is long-acting penicillin G, also goes by the brand name Bicillin LA, for treating all persons infected with syphilis. For persons staged as primary, secondary, and early latent syphilis, only one dose of 2.4 milliunits Bicillin LA is needed to clear the infection. Doxycycline is still listed as an alternative option for non-pregnant persons with penicillin allergy in the full 2021 treatment guidelines, but it must be administered at 100 milligrams twice a day for 14 days. For late latent syphilis or unknown duration cases, the duration of treatment is longer. Late latent cases must receive 3 doses of 2.4 million unit bicillin administered at 1-week intervals. It is not appropriate to space doses more than 9 days apart for pregnant women. If any doses are missed or spaced more than 9 days apart, the patient must restart their weekly injections. For non-pregnant persons with penicillin allergy, the alternative is 100 milligrams doxy twice a day for 28 days. For persons with neurosyphilis and ocular syphilis, it is a recommended regimen of aqueous crystalline penicillin G administered at 18 to 24 million units daily as 3 to 4 million units IV every 4 hours or continuous infusion for 10 to 14 days. Pregnant women with a penicillin allergy should be desensitized and treated with bicillin. Providers can consider running a sensitivity test to validate the presence of an allergy before proceeding with desensitization. If the provider does not have the ability to run a sensitivity test, or if the sensitivity test comes back reactive, then bicillin is the only treatment option for pregnant persons, and they will need to be desensitized and treated with penicillin. Pregnant women should be treated based on their stage. If it is staged as an early case, a second dose may be beneficial under the following situations. Syphilis is diagnosed during the second half of pregnancy, and timely sonographic fetal evaluation cannot be performed, or there are sonographic signs of fetal or placental syphilis. To ensure adequate treatment, missed doses are not acceptable for persons staged as late latent. The recommendation would be to restart the full course of treatment if any doses are missed. Similarly, if any doses are spaced more than 9 days apart for pregnant clients, they would have to restart the full course of treatment. For this reason, it is important to thoroughly educate patients to try to omit the possibility of having to restart medication. In order to prevent congenital syphilis, appropriate treatment should be initiated more than 30 days prior to delivery. All persons should be retested at delivery, and evaluation of the infant is recommended to ensure congenital syphilis has been prevented. Now, you receive labs on a patient that has no history of syphilis and no evidence to indicate that this is an early case of syphilis. The provider stages the case as primary since this is the first time they have had syphilis and prescribes 2.4 million units of bicillin. The patient is 3 months pregnant. What, if anything, should you do? This person did not receive appropriate treatment for their stage and they are pregnant, so they would be a high priority for follow-up. At minimum, you would want to reach out to the provider to offer education on staging and make a recommendation to treat for late latent syphilis. If the provider is unwilling or unable to offer the appropriate treatment, during your partner services interview, you can refer the case to another location to receive the full course of treatment. In this lesson, you practice identifying appropriate treatment based on the case information and staging. We also discussed how penicillin is the only treatment option for pregnant persons. We also discussed how some pregnant persons staged as primary, secondary, or early can benefit from receiving a second dose of bicillin. And finally, we discussed strategies for treating persons with a penicillin allergy.